Hello, it's Friday, February 22nd. It must be time for another legislative update. It's been a busy week.
Very busy.
In Raleigh. We started off with the introduction of a new bill around association health plans. This week, the Senate leadership announced Senate Bill 86 on association health plans. You'll remember last year we talked a little bit about what the Farm Bureau was looking for to create an option out there that would allow people to kind of pool together and provide them health care coverage but not call it insurance. Okay, this doesn't do that. This does something different. This takes the Trump administration labor rules, the new changes that came out around MEWAs and groups coming together, and gives them new options for how to form group coverage healthcare, both in small groups and large groups.
Right, and it's also under the Department of Insurance oversight too,
That's
which
right.
is different from the bill from last year.
Right, which was vitally important to everything that we've been talking about, especially with all the changes in Medicaid that we've been arguing for years. We're still looking at all the details of this bill and how it would actually affect the market, how it would affect MEWAs that are currently in place, like the MEWA that the North Carolina Medical Society has. And so we'll be getting back with you more info about this, but the importance of this bill is really that this is another one of those opportunities to help make sure that we're providing affordable options to every North Carolinian. And when we look at the gap in coverages out there right now and all the talk around expansion, this is another one of those opportunities that we've talked about that could help cover some of those people.
Right.
So we're going to be paying close attention to this bill and other bills related to this. I would expect there to be some more this year. But keep an eye out for that one on the blog, and we'll be sure to bring you updates as well.
And also, yesterday, the Senate Health Care Committee met to give an overview of the study bill that was passed last session. If you recall, the naturopathic study committee gave its results to the Senate Health Care Committee and went through those recommendations. And we still have some concerns over that, particularly with the drug formulary that they're interested in providing that came out of that study. So that's something we'll be closely following and expect them to file a bill next week.
Yeah. And you'll remember that the naturopaths have been looking for licensure for a long time. And this is not something that we've objected to the higher trained naturopaths, the fully accredited naturopaths getting licensure. But we did set a number of stipulations over the year that have always seemed to kind of fall apart at the end. And they just have not been able to find agreement. We've not been able to find agreement. They've not been able to find a pathway forward. This seems to be the closest pathway they've had.
Right.
In a long time.
And the first recommendation of the committee is for them to create an independent licensing board.
Yeah. Also this week, probably the biggest news that happened this week was on Tuesday. It was a combined House Health and Senate Health Care Committee meeting on the state health plan. And at that meeting, the treasurer came and spoke. If you saw our tweets this week, you might have seen where you could watch that video on our YouTube page. In addition to that, there were multiple speakers from various hospitals across the state representing the North Carolina Healthcare Association as well as independent other individual hospitals. And then there were questions by the committee members of all those speakers. We definitely saw a determination by the treasurer to continue to move forward with his plan to set the reference-based pricing according to Medicare in the way that he's talked about in generalities. We still don't know exactly what that means because we have not seen a rate schedule for that. So we don't know exactly what it means other than the idea of paying certain codes or certain percentages around kind of general area of codes out there. But there was a lot of discussion, and we expect there's still probably going to be some action by the General Assembly around this, even though the treasurer was very discouraging of that. So we'll be paying close attention to that as well.
So for next week, so preparing you for next week, we'll have a Senate Health Care Committee and a House Health Care Committee, but in the House Health Care Committee, there will be the NC HealthConnex House Bill 70, which would exempt a certain group of providers, including psychiatrists and other mental health providers, from connecting to the NC HealthConnex, which is set to go into effect in 2020, but this would push them back until 2021.
Yeah.
And this is important because they are supposed to be connected at this 2020 time frame, so it would push them back a whole year in order to be a part of Medicaid.
Right. And remember, this whole thing is important because if you're not signed up by June of this year, you can't get reimbursed through Medicaid any longer. So I know a lot of physician practices that are still on paper are trying to figure out what are the exemption processes for them alone. And the department continues to talk about various options. This bill speaks directly to it. So we'll be watching this one closely and paying attention to see if there are other exemptions beyond psychiatry, mental health.
Right.
Last thing, we've got a great week ahead next week.
Yes, we have the North Carolina Academy of Family Physicians has planned their White Coat Wednesday for this week. So they'll be around the building talking to their legislators and members of both health and health appropriations about issues that matter most to them.
Yeah, we expect a lot of people down at the General Assembly next week talking about healthcare issues. So we're excited that the Academy is going to be here to make sure that we're talking about primary care next week. So that's it for updates between now and when we come back to see you next Friday. Be sure to look at the blog because daily, as bills are being filed, summaries are going up there. We're looking for your comments on those summaries to make sure that you're telling us whether you have concerns about how these bills might impact your practice. And look at our Twitter feeds for ways to connect. I know that a number of you have been clicking through and actually listening to some of these testimonies live from the links that we're sending out. So we're excited to hear that. All right. Have a great weekend, and we'll look forward to talking to you next week.